Dr. Neelam Tejwani. Please come, madam. And she is going to present on the role of yoga, better outcome of pregnancy. Wonderful.
खोल दो उसको बोला एंटर करने से फर्स्ट लाइट आ जाएगी ना अपने आप नहीं आ रहा First of all, very good afternoon to all of you. थोड़ा सा adjust करना. My topic is role of yoga for the better pregnancy outcome. Motherhood is the sweetest dream of all the women, but as rose brings thorns with it, so is the distressing labor pain. As it becomes a nightmare for some women, but for many women, normal labor may be easy and trouble-free, provided a rational approach is made with the beginning of the pregnancy. As a practicing gynecologist, I know every lady has to face many problems during her antenatal period, during labor and during postnatal period. And these problems can be solved to some extent if an approach is made from the starting. Now here are some problems which are faced. First of all, we come to the problems which are faced during antenatal period. First of all, in the earlier months, there are hormonal changes, so leading to morning sickness. That is, whenever the lady gets up from the bed, she has nausea, vomiting. Sometimes it becomes very intractable and very troublesome for the lady. Then fatigue, irritability, depression, and mood swings. She has to calm down. Some relaxing exercises can be given to her to relieve these problems. Now the second main problem is constipation, acidity, indigestion. The reasons are the pressure of gravid uterus on the intestine and colon, then the hormone progesterone leading to the atonicity of the gut. There is delayed emptying of the stomach and less physical activity. Next is varicose veins, especially in the legs causing leg pain, and in the rectum leading to bleeding piles, which becomes a very distressing situation for the lady. Then ankle edema, then breathlessness. There is increased intravascular volume during pregnancy as well as increased cardiac output. It increases by 30%. And there is shifting of the diaphragm upwards because of the enlarging uterus, leading to less space and leading to breathlessness. There is stress because of many reasons, leading to pregnancy-induced hypertension, which is a reason for many other problems like intrauterine growth retardation, baby may not grow properly, oligohydramnios, that is less water around the baby, which may be reason for the fetal distress and even fetal death inside. Then placental insufficiency, that is less blood flow towards the baby, again leading to fetal hypoxia and fetal death. Then comes backache. Bad posture leading to the lumbar lordosis because of the enlarging uterus, calcium deficiency, and lax pelvosacral and pelvococcygeal ligaments, joints and tissues around under the influence of hormone relaxin, which is released during pregnancy. And insomnia, that is lack of proper sleep. Now we come to the problems which are faced by her during labor. She needs to tone up her pelvic floor muscles, abdominal muscles, back muscles and perineal muscles to have a fruitful and almost painless labor. A lot of pushing is needed. So deep breathing exercises and pranayam can help her in this situation. There is need for analgesia and it becomes a very challenging issue, analgesia during labor. Analgesic drugs are used, but as we know, every drug has its side effects, and if overdose is given or even in some normal doses, it has side effects. It may lead to depressed baby, so hypoxia and sometimes fetal death even. The second mode is epidural analgesia, but it needs expertise. Strict monitoring throughout the labor is needed, And the chances for the interventional delivery, that is forceps or vacuum delivery, increases if we give epidural analgesia. Now we come to the postnatal problems. There is fatigue of labor, backache because of the bad posture, laxity of the tissue, sometimes infection, urinary tract infection, constipation leading to backache. There is depression and irritability, lack of sleep, proper care. Then lactation is another challenging issue, and the baby care. Now baby has arisen, so baby care is another issue. Genital prolapse. Uterus involves to the normal size in 6 weeks. Until that time it is heavier, and abdomen is lax, perineal pelvic tissues are lax, so leading to genital prolapse, which may become troublesome problem later on. And the stress incontinence. There is tear of the vesico-uterine vesico-vaginal fascia leading to stress incontinence, but it can be relieved if proper exercises are started at the proper time. Then reshaping of the body. Extra fat, extra weight has to be reduced after delivery. It becomes challenging. Everyone knows what is pregnancy. It is cessation of menses during the reproductive period in an otherwise healthy individual having previous normal periods otherwise. And the normal duration is 38 to 40 weeks. I have already discussed the problems of prenatal period. There are 3 stages of labor: first stage, second stage and third stage. The postnatal exercises should be started to improve the muscle tone which are stretched during pregnancy and labor, especially abdominal and perineal muscles, to educate the mother about the correct posture so that the backache can be prevented, and to prevent the genital prolapse and stress incontinence. Initially, light breathing exercises can be started with the leg movements. The exercises for the toning of pelvic floor muscles, back muscles and abdominal muscles are started later on. Some patients have psychosis, even post-delivery depression, which can be alleviated by simple relaxing techniques. We have conducted a study of 30 patients. Some patients followed and the questionnaire was designed to assess the effect of regular yoga exercise, medicine and diet, and follow-up was done to see the mode of labor, complication and the outcome. These are the results. The patients who never followed the yoga exercises or exercise schedule and diet and follow-up regime, 7 out of them had cesarean, 3 only delivered normally, but they have critical problems. While the patients who followed it regularly, 10 out of them delivered normally, only 2 had some critical problems and only 1 had cesarean. So here is the difference between the patient who followed the regime and didn't follow. The labor pain is experienced by most women with satisfaction at the end of successful labor. Antenatal classes, sympathetic care and encouraging environment during labor pain reduces the need for analgesia. The drugs have an important role to play in the relief of pain of labor, but it must not be supposed that they are of greater importance than proper preparation and training for the childbirth. Yoga may be the solution for many pregnancy-induced problems and easy and successful labor. The flexibility of the perineal tissues, ligaments and joints can be increased by simple yoga exercises, which can be started with the starting of pregnancy. More will be the flexibility. It will make the labor painless and easy with less maternal and fetal complications. The mental and physical preparation of the woman is necessary during antenatal period, which can be achieved through different yoga techniques such as asanas, fast stretching, backward, sideward bending, torsion, extremity stretching and relaxation. Yogic pranayams, breathing practices, dhyan,